I'm nearly 30 and have been wondering about getting a hair transplant for some time. What's your advice? I've attached pictures. My hairline seems to have a convex shape and pretty bizarre. My uncle on my mom's side is thinning. He's 60, but apart from that, my family has good hair. It really has started to bother me. I know this may sound vain. I'm not looking to have a perfectly straight hairline, just a hairline that looks decent when held up, etc. I would appreciate your comments on what you think I should do or not do. P.S. This is my hair wet and stretched back. Thank you so much, Dennis.
Thank you for your question. You're nearly 30 years old and you've submitted photos that where you have a desire, expressed a desire that you want to have a straight hairline and that you feel that your current hairline looks bizarre. You've also shared with us the family history where an uncle is approaching 60 and is just beginning to thin. Otherwise, you have a family where hair loss is not significant. So that's great. Now the question that we have to answer, of course, is how motivated are you to have this lower hairline? Unfortunately, the perception of hair transplantation through very aggressive advertising appears to create this perception of an easy procedure. But I want to just share with you a little bit about how we make these decisions in our practice when someone like you comes and says, I want a lower hairline. First of all, I appreciate that you submitted photos with your hair wet. Very often, someone with good, thick individual hairs that are in caliber very thick, when the hair is wet, you see a lot more scalp. When your hair is wet, you look like you still have a great amount of volume. So you have to ask yourself about how motivated you are to have this frontal hairline. You see, when you think about hair transplant, we have to think about the area that needs the transplant and the amount of hair available to transplant. Now, of course, since you haven't had a transplant before, we would evaluate the donor area and determine the density of hair and how much hair would be available to transplant. Then we discuss the options in terms of the type of transplant. There's follicular unit extraction, there's follicular unit transplants, also known as the strip method. But most importantly, it's very important to understand that there is no such thing as a scarless hair transplant. A lot of people are making claims using FUEs where they're making little punches to remove individual hair clusters and then stating that there are no scars or scarless. That's not true. There's actually, in geometric terms and absolute numbers, more scars with FUEs than there is with the strip method. And if you were to go and get a second FUE, you'll definitely have a lot more scars. So whether you're using a robot or a new device or just doing it manually, hair transplant means scars in the back of the head. Now, you have to then, when we do an examination, we discuss, do you go into water a lot? Is your hair wet a lot? You know, we're looking for places where the scars would be obvious and could draw attention and be a source of potential embarrassment. Now, that being said, let's say that's not an issue for you. Your hair is not wet a lot and you're fine with whatever type of scars you'd have. Then we have to think of how many transplant sessions would we need to achieve your goal. You see, one of the biggest challenges of transplant surgery is achieving density. And the level of density you have is very difficult to achieve with a single transplant surgery. Lots of doctors make all kinds of claims about the number of grafts per square centimeter. But although technically a skilled surgeon or technician can place these hairs very close together. Every hair needs a circle of skin, of tissue, which means there is an absolute limitation. And a lot of times, depending on the transplant factors, such as the method, the survivability of the grafts, things that we can control, things that we can't control, the yield of the transplant can be not the same as the number of grafts placed. I've had patients come who have lost over 90% of their grafts when their transplant was done elsewhere. Now those are exceptions, and in one patient in particular that comes to mind, his blood pressure was not very well controlled, and I think this hair transplant facility did the transplant in spite of the blood pressure, and of course it led to more bleeding, which led to, of course, the grafts not taking. So when you are in that transition period, then that appearance may be undesirable for you, because that is something that is very, very hard to camouflage. When we try to do a hairline lowering procedure, we try to be conservative and feather the transplant so that it starts from the edge of the existing hair and goes downward, as opposed to drawing a line lower down and then trying to fill that space with grafts. That's, for us, that's not the way we like to work. So it's sometimes nice to want something like this where your hairline is lower, but I think that most people would disagree that your hairline looks bizarre. I suspect this is most likely a familial trait, and it's not not really as bizarre as you may feel at this time in your life. You could be sure, coming from me, that a lot of people would envy the amount of hair that you do have. So I think you need to meet with experienced hair transplant surgeons and get some opinions, get some understanding of the realistic expectations, think of what you're willing to put up with. In our practice, we try to maximize our graft survival using a material called extracellular matrix. It helps with the wound healing in the donor area. It helps with the survivability and healing process for the grafts. And for those people who are actively having thinning hair, it actually reverses the thinning process and makes those hairs thicker, and we call that hair regeneration. In your situation, if we were to do a microscopic evaluation, there's a good chance that we won't find any miniaturization. So what you're looking for is a very cosmetic, specific type of result, which is certainly fine as long as you understand the process and the steps involved. So I hope that was helpful. I wish you the best of luck. Thank you for your question.